I'm the CEO of NAMI, the National Alliance on Mental Illness in San Diego County. And I'm very fortunate to be at Aspen today to talk about mental illness, the state of mental illness in this country, stigma, prevention, early intervention, all the good stuff around mental health care. And this is?
And my name is Patrick Hines. I am a Health Innovation Fellow along with Shannon. We're in the inaugural class of Health Innovation Fellows, and I too am happy to be here at Spotlight Health. I'm CEO and founder of Functional Fluidics. I'm also a pediatric ICU physician at the Children's Hospital in Michigan in Detroit.
So one of the reasons why both Patrick and I came out to Aspen Spotlight Health this week is we were asked to talk about the subjects that really aren't talked about at all. And mental health is one of those subjects, specifically around the still remaining high levels of stigma. So for example, there was a research study that compared the 1950s to today, and individuals were asked if they thought that mental illness was a true disorder or a sign of personal weakness, and those values actually increased. So people thought it was a true disorder and not something that a person made up. However, if they were asked if their child could marry somebody with a mental illness, if their coworker could have a mental illness, or their neighbor could have a mental illness, all those values, in fact, went down. So in a sense, what we're saying is that mental illness is real, but you must maintain a 100-foot radius from me at all times. So I felt very fortunate to be able to come to Aspen amongst these leaders to really talk about the true state of mental health in this country and what are some of the things that we can do to make this a better place, particularly utilizing peers, so people with a mental illness and family members, as experts to build bonds of trust between patient and provider. So I've asked Patrick to be with me on this discussion today as an ICU pediatric care doctor and his experience with mental health and the kids that he sees at his hospital.
Yes, so although mental health isn't my primary area of expertise, it affects what I do in a substantive way. And I'm fortunate to have the relationship I have with Shannon and can bounce ideas and questions off of her. Where my job, in terms of my patient care role, intersects with mental health, we see a lot of kids, particularly adolescents, that come in with attempted suicide, drug overdoses, and the rate in which we're seeing that in our particular pediatric ICU is certainly going up. And there's lots of questions that we have as non-mental health providers about what are the reasons for that. I mean, I can treat toxic ingestions. I can put someone on dialysis. I can sort of fix the end results of it. But I think it's so much more important to deal with it on the front end, and having access to folks like Shannon to better understand why these patterns exist in society now are the most important things that we can do, although the results of that are things that we're seeing downstream where I practice.
And also some of what Patrick talked about was kind of preventing the avalanche effect. So if you compare mental health to MS, for example, there was actually this wonderful psychiatrist or psychologist who had MS himself. And what he did is he wrote this article that said, in the MS community, you really support, or you feel comfortable, you trust your physicians, your medicines, your support team. But in mental illness, generally due to the fact that a majority of people are brought into a mental health treatment facility in the back of a cop car, you don't trust your medicines, your doctors, the people around you. So we really need to create this level of trust. And some of the issues that Patrick brought up earlier at our talk this morning was about how that starts also at home, or what are those factors that we can see at home to prevent this avalanche that could come next. I don't know if you wanted to talk any more about that.
Yeah, I completely agree. Once we're dealing with it on our end, it's a much more difficult situation to deal with, and there's so much less that we can offer at that point. But there's so much more we can offer just based on what we've learned from talking with you. The stigma issue, the labels, that sometimes beyond being a physician, as a human being and a family member who has family members that have struggled with mental illness, how do I be a better support so that they don't end up dealing with some of the same issues that you're talking about? So both as a provider, but then as a person who has loved ones and people that I care about that are dealing with these types of issues, I think it's so important that we understand how to best support people with any type of illness. Yeah. Mental illness being an illness like any other thing that we deal with in medical care.
Mm-hmm. Yeah, I agree.
We have a couple questions from Facebook.
Great.
First one is from Garrett. He says, have you seen the TV show 13 Reasons Why? What's your take on the effect it's having with teens?
So I have not seen the show, but I am very much aware of it. And if you go to the TED Foundation, they have some great talking points. So I've heard multiple perspectives. Some people think that it's a great way of opening up the conversation around suicide and suicide prevention. And then I've heard on the other side folks upset that there wasn't at least the lifeline, the national lifeline number before and after each episode in order to encourage teens, if they need it, to speak to somebody after watching an episode. So there's two kind of sides that have been coming out around this, but if you go to the TED Foundation, they have some great talking points around the 13 Reasons Why show.
Another question from Garrett. He says, is there a simple thing you can add to your daily routine to improve your mental health?
You know, there's actually some great apps that go around just breathing, or in fact, I would encourage anyone to go to the website nowmattersnow.org. It's very much takes the DBT methodology and breaks it down into kind of, easy to kind of utilize. And one is obviously the breathing technique or opposite action sort of stuff. I've also been doing a lot of reading around gut health and mental health. So specifically, insomnia issues or anxiety issues has been tied to some of the nightshade family foods. So there's some things in health and nutrition that really is coming up right now. I don't know if you have any more.
Yeah, one thing I would mention, even in the ICU environment, when you talk about things like breathing and really learning how to do that, and to be in better, more mindfulness, more, of a conscious state about your own emotions and what your body's dealing with. In our environment, where we use a lot of sedation for procedures and things like that, our child life staff have actually learned about yoga and meditation, and actually have had pathways to teach patients, children, adolescents, these skills that commonly come into contact with the healthcare environment and have to have these interactions that are very anxiety provoking. And the ability to learn deep breathing and how to sort of regulate your anxiety makes a big difference when they come into these really high stress environments. So certainly in your day-to-day life, those things can be really helpful if you're talking about taking a test or interviewing for a job or just regular day-to-day things. So I would be a strong advocate of that.
Yeah, me too. Yeah, me too.
Last question from Facebook. Are there any groundbreaking technologies or treatments for mental illnesses that you're particularly excited about? Where do you see the most progress taking place in the treatment of mental health?
Yeah, actually, we've been hearing some very cool ones here at Aspen today. I'm not going to get it all correctly, but there was some that Daniel talked about, and actually one of our other fellows, Nisha, talked about, where they stimulate the brain. So if you're in a deep depression, they can stimulate the brain in order to help alleviate some of the depression symptoms. Daniel had talked about a few items that also sounded interesting. There's a lot going on with virtual reality, so VR being used to help with PTSD issues, some anxiety issues. Unfortunately, I don't see that much that was here that was related towards schizophrenia, which is something that we got to make sure this population doesn't get left behind, because they deserve as much treatment and recovery as the next person. So there are things that seem to be coming on board. And that's all I've got right now, but there'll be more.
Yeah. And I guess the only thing I would add to that is that there are a lot of really new approaches that all of which aren't necessarily validated and proven. I would always sort of harken back to just the old-fashioned balance and support and supporting each other as human beings, and not creating situations where we need these really novel and unique ways to sort of deal with mental health issues. Always think about the things that, as human beings, we're social creatures. We need to be connected to one another in a positive way.
Yes.
So just thinking about those kind of things in your life.
Yes, yes. So just to kind of sum it up, I would really like to say to everyone out there that either has a mental health challenge themselves or family members with somebody that you love that has a mental illness, that to know that you are not alone, that we need to end the isolation, any feelings of guilt or shame. We're all in this together, and please reach out at NAMI San Diego or any other organization that you feel comfortable with, but just to know that you're not alone. So thank you.